It can be truly worrying when your little one is struggling with a cough and sniffles, especially when it seems to drag on, making you wonder when they will finally feel better. Understanding the typical course of illness can bring a lot of peace of mind, helping you know what to expect and when to seek further advice. Bronchiolitis, a common respiratory infection in infants and young children, typically lasts for about 2 to 3 weeks. While the initial symptoms like a runny nose and cough might appear first, the more characteristic wheezing and difficulty breathing usually peak around day 5 to 7 of the illness, before gradually improving. The duration of bronchiolitis can vary significantly based on several factors, which is why it is not a one-size-fits-all answer. Younger infants, especially those under 3 months old, often experience a longer and more severe course because their tiny airways are more easily obstructed. Underlying health conditions, such as premature birth, chronic lung disease, or heart problems, can also extend the recovery time. Additionally, exposure to other viruses during recovery might prolong symptoms or even lead to new infections, making the overall illness feel longer. To help your child through this period, focus on supportive care at home. This includes ensuring they stay well hydrated by offering small, frequent amounts of fluids and using saline nasal drops with gentle suction to clear stuffy noses, especially before feedings. Keeping them comfortable with appropriate pain and fever relief, if needed, is also important. Always monitor their breathing for any worsening signs and consult your pediatrician if you notice increased effort in breathing, poor fluid intake, or decreased alertness. A key aspect many parents learn is the importance of understanding the difference between a lingering cough and active illness. Even after the acute symptoms of bronchiolitis have passed, a mild, post-viral cough can sometimes persist for several weeks. This is a normal part of the healing process as the airways recover, and it does not necessarily mean the infection is still active. Focusing on rest and avoiding irritants like smoke during this recovery phase can be very beneficial. Knowing that bronchiolitis often follows a predictable timeline, with symptoms peaking and then gradually receding over a few weeks, empowers you as a parent. By understanding the factors that influence its duration and focusing on supportive care, you can confidently navigate this common childhood illness, providing the best comfort and support for your child while knowing when to seek professional guidance.